Dr. Marcus here. I've been a practicing dermatologist for 25 years, and I have seen small choices become long-term damage. Today, I am going to list 11 mistakes that age you faster, and you should never put them on your face. This is not scare tactics. It is a direct guide so you can avoid accelerated thinning, hyperpigmentation, and chronic inflammation. By the end, you will know what to stop, why it speeds up visible aging, and safe alternatives to use immediately. The skin on your face lives with a delicate pH around 4.5 to 5.5 and an active microbiome that acts like a small army of caretakers. Change that acid mantle even a little, and you alter the terrain like turning fertile soil into dust. Those shifts invite irritation, loss of elasticity, and risks like rosacea and atrophy that do not reverse overnight. First, the quick science. The acid mantle is a thin film of sebum, sweat, and microflora that keeps pathogens out and enzymes working properly. Think of it as a battery that powers barrier repair. Strong alkalis or oxidants raise pH and disrupt lipid packing. Peroxide and concentrated alcohols act as oxidants and strip oils, while strong acids used improperly remove protective proteins. That process triggers inflammatory mediators and degrades collagen over time. The microbiome responds to these changes by losing beneficial strains and allowing opportunistic microbes to proliferate, which perpetuates redness and breakdown. In plain terms, if you repeatedly use the wrong topical, you speed up fine lines, pigmentation, and loss of bounce. With that clear foundation, let us go into the list, and I will give the reason, an image to make it real, and a practical safe swap. Number 1. Sodium hydroxide containing depilatories or strong industrial cleaners that people sometimes try as DIY quick fixes. Why it ages you? These are highly alkaline and denature proteins and lipids, causing long-lasting barrier damage and potential scarring. Picture a fabric scorched and thinned. Alternative sensible step: use a cosmetic-grade topical hair inhibitor or seek professional waxing, threading, or laser with a licensed technician. In the clinic, a patient named Maria applied an industrial cleaner once and complained of stinging and a velvet-like raw texture. I asked her to stop immediately, rinse with cool water, and use a bland emollient. The smell lingered like burnt plastic. Her skin felt rough to the touch, and she noticed sensitivity when wind hit her face. Maria then came in for a patch test, and we documented a pH drop back to safe range only after weeks of barrier repair. Sensory notes in that scene: the metallic tang of the cleanser, the sharp sting, the dry cracking sound when she spoke, and the cool wetness of compresses on her skin. Number 2. Undiluted apple cider vinegar and concentrated fruit acids left on the face as brightening hacks. Why it ages you? They can cause chemical burns and post-inflammatory hyperpigmentation, which makes skin look older.
Floral note that lingers, then a faint itch around the temple. Replace scented products with fragrance-free formulas, and always test a product on the inside wrist or behind the ear first using a patch test before full facial application. Number 7. Unregulated DIY eyelash and brow tints and dyes. These products can cause burns and pigment loss around the eye area and even trigger ocular injury. In a dialogue scene with a friend named Anita, who was an influencer, she told me, "I DIY tinted my brows." I asked, "Did you test near the eye?" She said no. I explained the formula can migrate into the eye and cause scarring. She went pale and touched the inner corner of her eye where it itched. We had a multi-exchange conversation that showed how quickly a casual cosmetic can escalate. Sensory details include the chemical scent, the stinging, and the sudden watering of the eyes. Number 8. Abrasive physical scrubs with crushed shells or nutshell granules. These tear micro-tears in the skin surface and encourage inflammation and pigment. Your hands may feel tiny grains crunching the skin, and you may smell oils added to the scrub, a sweet coconut scent. Use soft chemical exfoliants in appropriate concentrations when advised by a professional, and avoid harsh granules. Now the backstory. I grew up in a small coastal town where my grandmother treated sun-damaged skin with cold compresses and sea salt. She loved the sea breeze and often told me that skin reflects life experience. That image stuck. I studied medicine and pursued dermatology because I wanted to protect people from avoidable damage and to restore dignity to those who had painful reactions from well-meaning advice. In residency, I saw patients like Maria and others who tried viral remedies and came in with sunburn-like scars and sensitivity. Those years on hospital wards gave me a perspective that medical knowledge must be practical and communicated simply. This journey from childhood curiosity watching my grandmother to clinical practice taught me that small daily decisions compound. It also trained me to ask what people are applying on their face and why, because the answers reveal patterns we can change for better outcomes. Number 9. Strong topical steroids used without supervision to treat acne or lighten skin. Steroids thin the dermis over time and cause visible atrophy, telangiectasia, and rebound inflammation. People often notice a fleeting improvement, then worsening and a pale paper-thin texture that is hard to reverse. One patient named Sam used an over-the-counter cream multiple times a day because it reduced redness at first. Within months, his skin had visible capillaries and fragile surface that bruised at light touch. The skin had a faint metallic residue and felt as thin as tracing paper. Number 10. Baking soda and strong alkaline masks. Baking soda has a pH around 9, which is grossly alkaline for skin, and it neutralizes acid mantle proteins. The result is increased irritation and potential for microbiome collapse. I once smelled the sharp, dusty scent of baking soda on a client who used it nightly, and the face felt sand-like and irritable. A better approach is to use mild enzymatic masks or consult for medical-grade topical exfoliants. Number 11. Sleeping with heavy makeup or not cleaning tools like brushes and razors. Friction and unclean implements introduce microbes and oxidized oils that promote inflammation and acne and long-term degradation of skin quality. Think of dirty silk pillowcases that trap oil and smell faintly of stale product. Instead, practice nightly cleansing and sterilize tools or replace sponges frequently, and use sunscreen daily to prevent UV-related collagen breakdown. Now, 2 moments of tension where choices matter. The first is when a person must choose between a quick fix that promises overnight results from an influencer and the safer, slower route that preserves structure. The tension is the desire for instant change versus the long-term cost. You can feel your pulse quicken when a product promises miracle brightening and you are tempted. I have watched patients wrestle with that decision in my office, holding tissues and looking at before and after images. The choice to wait and to use a tested product is often the hardest emotionally, but it is the one that preserves collagen and avoids atrophy and pigment that looks older. In those minutes, you smell the synthetic perfume of the sample you were given and feel the slick texture, and you must decide if a short-lived glow is worth potential permanent harm. The second tension is emergency, like when a home dye or acid has reacted with sun and you notice blistering and spreading pigment. The panic is immediate and people call friends or rush to urgent care. I remember Lucas calling me at night, his voice shaking, because he had applied lemon to reduce a freckle and later found dark splotches. He wanted an instant cure. I explained step by step what to do and what not to do to avoid making it worse. In that moment, the room smelled faintly of citrus and there was a tight burning under the fingers. The decision to avoid home-aggressive fixes and to seek professional care can be the difference between recovery and long-standing mark. These are the practical rules to live by. Stop applying concentrated household products to your face. Always patch test on the inner arm for 48 hours before full facial use. Dilute when a product can be diluted and only when the safety data supports it. Look for pH-balanced formulas and products labeled as non-comedogenic and fragrance-free. Avoid combining certain topicals with sun exposure, particularly citrus oils and some plant extracts. When in doubt, consult a dermatologist or an esthetician for supervised treatments. Sterilize tools and replace sponges and razors frequently to avoid microbial load. If you have persistent redness or burning, seek professional help rather than stacking home remedies. Quick recap. Action. Steps you can take now. First, stop the risky item and rinse the face with cool water. Second, apply a bland, barrier-repleting moisturizer that is fragrance-free and low pH. Third, schedule an appointment if there is blistering, intense pain, or spreading pigment, and tell the clinician exactly what you applied and when. Remember that healing starts with removal of the insult and supportive care. Epilogo at 1 month. After 1 month of stopping damaging products and using a gentle daily routine, you should notice reduced irritation, more even texture, and less tightness. Your skin will begin to rebuild lipids and the microbiome will start to repopulate with beneficial strains if you use non-irritating cleansers and avoid harsh exfoliants. You may still see residual pigment and fine lines, but they are more manageable with sunscreen and topical treatments like retinoid and vitamin C under guidance. Be patient and celebrate small wins like reduced stinging and better sleep without itch. Keep a brief skin diary to track products and reactions, which helps your clinician if you need follow-up. Epilogo at 3 months. At 3 months, consistent barrier care plus sun protection begins to show structural improvements. Collagen synthesis responds slowly, so you will notice subtle improvements in firmness and fewer reactive flares. Continued avoidance of phototoxic substances and regular use of antioxidant-rich sunscreen and topical anti-inflammatory agents reduces cumulative sun and chemical damage. If you used topical steroids unsupervised or had chemical burns, there may still be visible atrophy or pigment that requires professional procedures such as laser or microneedling under expert care. Do not try aggressive at-home treatments to accelerate repair. They can backfire and cause setbacks. Epilogo at 6 months. By 6 months, with a thoughtful routine, including low pH cleanser, moisturizer, sunscreen, and targeted treatments, the skin can regain resilience and appear younger than when you were chasing quick fixes. Long-term habits drive aging outcomes. Protect with daily SPF and avoid the 11 mistakes I listed, and you will slow the look of aging. If there are scars or stubborn pigment, a dermatologist can tailor treatments to restore texture and tone. Your long-term success is a combination of protection, restoration, and avoiding repeated assaults that erode the acid mantle and microbiome. If this video helped you, please subscribe for more practical, evidence-based skincare guidance. Leave a brief comment naming which item you tried and what happened so others can learn and so I can address the most common mistakes in future videos. Again, do a patch test before new products and consult a professional if you have severe or persistent reactions. Take care of your skin as you would take care of anything you want to last, because thoughtful daily choices are the real anti-aging strategy. Your skin thanks you for respect and for a little patience.